The bill for being treated with a ventilator for breathing problems could be $23,000 or $120,000, all depending on which state you live in. For the first time today, the federal government revealed what different hospitals nationwide charge for procedures, revealing massive disparities. That first graph compared 2 states, but the numbers are even more striking if you dig into individual communities. A simple case of pneumonia is $5,000 in Water Valley, Mississippi, but $124,000 in Philadelphia. If you need a joint replaced, go to Ada, Oklahoma, where the average tab is just $5,000. In Monterey, California, $223,000. Why the gap, and what does it mean? Wonkblog Sarah Kliff is here with some answers. Hey, Sarah.
Hey.
So we sort of cherry-picked like these different places, these different communities, but sometimes just right next door, the differences can be amazing.
Right. You know, one of the things we looked at in this really giant data set, we're talking about 163,000 lines of Excel data. One of the most striking examples was in Miami, where you have Jackson Memorial Hospital and the University of Miami Hospital, 2 nonprofits literally across the street from each other. And you're looking at thousands of dollars of difference of how much a heart attack they say that will cost to be treated there.
To some extent, it's a sticker price, right? If we look down at the reimbursement rates, they don't follow these massive differences.
Right. You know, it helps almost to think about it like when you go in to buy a car, where you're going to have a sticker price on the actual car, but if you're negotiating with the car dealer, you might get a lower price, and that's essentially what Medicare does. Medicare has millions of patients, and they tell hospitals, this is how much we're going to pay you, and they get reimbursed for a set amount that has very little to do with these prices that they set.
Yeah, and let's just look at that Miami example. If we pull up the reimbursement rates for those 2 hospitals, we see that
they're much, much lower. And you see, so for the heart attack, the hospital that was charging $166,000 is getting $27,000 in reimbursement. Its competitor across the street charges $89,000, gets $33,000 in reimbursement.
So then help me understand what in the world these numbers mean. They're really just a sticker price? Do we care at all then if this isn't what people are actually paying, what the government's actually paying?
The part where, you know, there's more of a sense that these do matter is for uninsured patients who don't have a Medicare or a private plan to negotiate for them. And this is essentially going to be the bill that they will receive. Or if you do have private insurance but you go out of network, this could be the bill that you end up with.
These hospitals apparently didn't want the information out there, and the government released it for a reason, thinking it would spur something.
Right. So when I've talked to them, what's been interesting is they actually talk a lot about this Time Magazine article that ran a few months ago called Bitter Pill by Stephen Brill. That was the longest article Time Magazine had ever run and really raised a lot of outrage, I think it's fair to say, about the lack of transparency in prices. Medicare then started looking at, you know, all the information it gets from hospitals and realized they have a lot of this price data, that hospitals have been submitting it. Up until now, it's been in this kind of clunky big data set that researchers buy. It's never been made public, and they talk about, you know, this specific initiative as part of a larger goal to bring more transparency into the healthcare system.
If the reimbursement ends up being roughly the same, why do I write a $160,000 bill rather than a $70,000 bill?
You know, when I've talked to hospitals about it, they have these large things called charge masters, which has the charge for everything from a joint replacement to a piece of gauze. And they've had these for ages and ages, and they tend to get updated each year. And it's those things, it would basically require overhauling those completely, which would be a very big task for the hospitals. So what they do is they kind of keep working within the confines of these charge masters.
Is there a practical application for us? The one that comes to mind is if I'm uninsured, I go seek out the hospital with the lowest sticker price.
Right now, this isn't linked to quality data, so we don't know, you know, is a hospital charging more because they have great surgeons, or are they just charging a massive overhead? And so one of the things that'll be important, and, you know, I think you'll see more research now that this database exists, is kind of making this a consumer-friendly tool where you can look at both cost and quality and get a sense of, you know, where, as someone without insurance, you might get the best deal.
Somewhere there's some guy who has a $150,000 bill because he was uninsured for some procedure, that had he been insured, the government or his insurance company wouldn't be paying anywhere near that.
Right.
And so this ridiculous charge master number, which is like putting $1 million price tag on a Toyota, is hanging around somebody's neck.
Up until now, you know, there really just hasn't been an imperative for hospitals to make their prices public. A lot of it is because most of us aren't paying for our own health care. So, you know, if I pay a $10 copay at the doctor, it just doesn't feel relevant to me whether my doctor is charging the insurance company $500 or $200. You know, at the end of the day, my bill is exactly the same. But you know what we're seeing right now in the health insurance world that might change that is, you know, switch to higher deductibles, more co-insurance where you're paying a % of your bill instead of a flat fee.
Yeah.
So as you know, Americans have more interaction with their healthcare costs, the thinking is you're going to see a lot more demand for people wanting to know before they go to the doctor how much it's going to cost.
Okay. So many questions around healthcare. Thanks for answering some of them for us.
You're welcome.